Okay, I'm recording our meeting. If you would like a recording of this later on, please just reach out to me. Thank you so much for joining us. My name is Michelle Bartlemay. I work with St. Luke's. We are here today for joint media availability with St. Luke's and St. Alphonsus Health Systems Primary Health Medical Group. Please mute your microphones and turn off your cameras for now. A leader from each of our organizations is here with us today. This is the order that you'll hear them speak. Dr. Jim Souza, Chief Physician Executive with St. Luke's Health System. Dr. Stephen Nimerson, Chief Clinical Officer with St. Alphonsus Health System, and Dr. David Peterman, CEO for Primary Health. So some ground rules. We're here to give you the opportunity to ask questions. Our leaders will provide you with a few short, timely updates, and then we will open the call to question and answer. When it's time, please raise your hand by clicking the button, and I will call on you. When you hear your name, unmute yourself. Please provide your name, news organization, and to whom your question is directed. You can also ask questions with the chat feature if you prefer that. And as a reminder for those joining the call today, just please mute yourself and turn off your cameras. And with that, let's get started with Dr. Souza.
Thanks, Michelle. Thanks, everybody, for joining us today. And thanks to my colleagues for joining today, too. I was going to just make comments in three areas briefly. What's happening on the ground in the St. Luke's hospitals, our concern about capacity for care, and then briefly why we're requiring vaccination. What's happening on the ground? Over the past 2 weeks, we have seen a doubling of our COVID inpatient activity, and we've seen a doubling of our COVID intensive care admission. That correlates with, there's day-to-day variability in this, but with a rough doubling of our test positivity rate. And it also correlates with the kind of doubling or more you're seeing in the state-reported cases these days. A little bit more specifically, 2 weeks ago, our COVID inpatient census across our health system was about 5% of our daily cohort of inpatients. And today that's at about 10%. So again, a doubling. The patients we're seeing are almost exclusively unvaccinated. I think the media is aware that recently Health and Welfare reported Idaho's data on this. And, between January and June, 98.7% of the hospitalizations were in unvaccinated people. This pattern has not changed over time. And if you were to interview, for example, one of our frontline hospitalists or one of our frontline intensivists, they would tell you that this pattern is still holding true, and that pattern is not because there weren't a lot of vaccinated people in January. Regarding the second topic here, briefly, the concern with hospital capacity for care. You've all been hearing from us throughout the pandemic, and this has been our concern from the beginning, was preserving that. I wanted to make the point that the situation happening now is a little bit different than it was during the surge that happened in November, December, and January. At that time, the story was COVID. We were pushed to our capacity, as all of us on these calls attested to, by COVID. Inside our health system, at that time, in January, December, COVID represented about 50% of our hospital admissions. Obviously, I just told you a statistic about what's happening right now. Now is different. And what's different is that over the past 2 to 3 months, there's been this across the board multi-diagnosis increase in acute hospitalizations for you name it, strokes and heart attacks and infections, such that our capacity for care coming into this doubling of COVID was already challenged intermittently over the last couple of months. If we have time during the interview, maybe we can all probably opine on what we believe is behind that overall increase in inpatient activity. But the point is that throughout this time, COVID was a relatively small and stable part of our inpatient care, 5%. Now it's doubled to 10%. And that is the straw that is straining the back of our care capacity. And I'm going to stick with this analogy. In addition, and probably most worrisome, is that the physicians on this call, the physician leaders on this call, all have experience with these surges, and we've experienced exponential growth 3 times now. So the problem with this straw, if you will, is that it has the potential to become an entire bale of hay over just a few weeks, and that would be a major problem. As to the topic of vaccination, I'll just make a brief comment. You probably want to hear from all of us on this. Why are we requiring vaccination? It's because of what we know and what we're seeing. We know the vaccines are really efficacious, right? I mean, this recent data that Health and Welfare shared with us points that out. We're not seeing COVID largely in the vaccinated population. We're seeing it in our unvaccinated fellow citizens. We know the vaccines are safer than getting COVID. We know that cases are surging and now straining hospital capacity. We know that this Delta variant is in our state and it's in our surrounding states and it's way more contagious. And we know that in our facilities, we care for really vulnerable people who do not get to choose whether or not they're seeing us on a given day. And we know we're not interested in losing another one of our employees to this preventable disease, or seeing them in a hospital, or seeing them long-term sick with COVID. So our bottom line, and I think you'll hear a consistent message, is we made this decision for the safety of our patients and the safety of our people who care for them. We went into this with about 80% of our people having received at least 1 dose of vaccine, meaning more than 12,000 of our staff were vaccinated. So that's kind of the report of what's happening on the ground and what's been behind our thinking at St. Luke's. And with that, I'll turn it to my colleague, Dr. Steve Nemerson from St. Alphonsus. Steve.
Thanks, Dr. Souza. Pleasure to be with you here today. Here at St. Alphonsus, we recognize that COVID is spreading and growing across Idaho and Eastern Oregon. We've seen our test positivity rates double. We were at 4% on July 4th, and that's a figure that we were pleased with because it meant we had control of this pandemic. It's now 9% and growing. That means we've lost control. We are in a surge. Others will say we're at the beginning of a surge, and that is true, but what we don't know is how bad this is going to get, and we don't want it to get completely out of control. We don't want to return to that environment that we were in a year ago when we were talking about contingencies and, God forbid, restricting the ability to deliver care. And we're not in that situation now, but we are concerned because it is superimposed, as Dr. Souza said, on top of record high census that we experienced throughout our health system. We can talk more about the reason behind that, but there is a lot of non-COVID illness. Now we're building on top of that COVID illness that's directly related to unvaccinated people. In terms of St. Alphonsus experience today, none of our patients in the intensive care unit that have COVID are vaccinated. They're all unvaccinated, and the patients that are at risk of losing their lives, it's because they're not vaccinated. In addition, as we are moving forward with our requirement that employees be vaccinated for COVID, we're doing that really with compassion and giving employees the choice whether they choose to be protected themselves and to protect our patients, or they choose to do work elsewhere. And that's really important to us because we feel we have a sacred trust with our patients and their families that when they come into our facilities and they're cared for by somebody that we employ or that we have a relationship and give the privilege of caring for patients in our facilities, that those people are not going to be carrying COVID. And yes, with the Delta variant, it is possible to harbor that virus, but we know that the vaccination reduces the possibility of transmitting it to somebody else. And so again, it's our sacred trust with our patients and their families and one another to ensure that we create the safest environment possible. In that context, I know there'll be questions about how we are dealing with that requirement, and I will say that we are dealing with it extremely well. The vast majority of our employees are highly supportive of this, and what is sad is that those that are questioning it have had their minds poisoned, as has the community, to a variety of misinformation, that we are in the process of sharing correct and accurate and truthful information in an objective way to allow our employees and our community members to make a smart decision, which we know as physician leaders is to get vaccinated. The last thing I'll reflect on before passing on to my colleague is that the relationship and trust between patient and doctor used to be strong, and I do not personally understand why that has changed. But sadly, we are experiencing that it appears to have been jeopardized in many cases. And so we are trying to do work to strengthen that relationship once again, merely by communicating as we are today, the truth with you, through you, to our community, and handling that with compassion, understanding that people have been made cynical, people have been questioning, and so we don't want them to come to St. Alphonsus and feel like we have an agenda here. Our only agenda is to save lives and keep people healthy and well. And so with those comments, I'm pleased to hand off to my colleague, Dr. Peterman.
Thank you. I'm not sure if I'm being seen or not seen. Mine is just showing a small square, but in any event, I wanted to go ahead and share some slides. So let me pull that up. Can you see my slides?
Yes, we can.
Okay. All right. So let me start with because of the large volume of patients we see at Primary Health with 20 clinics and our involvement at the front end with coronavirus, we really have represented the canary in the coal mine. And I guess the best way to put this is, unfortunately, our data has been 100% correct to predict and to share with Dr. Susan, Dr. Nemerson, what's going to come to the hospital. I wanted to say just one other thing. When you listen to Dr. Susan, Dr. Nemerson, you're listening to two physicians who are very experienced and both do intensive care medicine. And you could tell by the way they're expressing themselves, there's a major concern. These are physicians who spent their whole careers, in a sense, dealing with really critical issues, but in a sense, being very calm about it. And I just want you to sense and feel their level of concern. And that's what we should be focused on today. That's a little bit of a personal side, but I just wanted to make sure as reporters, because I really feel you have the responsibility to articulate to the public the level of concern we as doctors have. So first of all, I'm showing you primary health testing of patients. Patients come to us for testing primarily because they have symptoms. So again, if that goes up, more people in the community have symptoms. From July 1st to today, you can see we've doubled. Yesterday, we had over 243 people, and so it's increasing every day. Very concerning. This is a slide of the positivity rate, and Dr. Nemerson referenced this. Back in May, we had a positivity rate that was not good, not acceptable, which was above 10%. And as we began to have vaccine and bring that down, we were down into the 6% range. And now look where we are today. We're back up to 14%, We haven't seen it that high since May. Again, very concerning. And whether you look at national data, CDC data, when you are that high of a positivity rate, I will use the same term that Dr. Nemerson used, which is it's out of control. This is a breakdown of the positivity rates of patients we test based on age. Unfortunately, every age group is going up. So this is 12 to 18-year-olds. That's a group of patients that we would like to get vaccinated. They've been slow on the uptake. We've seen there a 30% increase, 6% to 8%. This is the 18 to 40-year-olds. We're concerned about this group because they're the group that's, in a sense, has been referred to as the bar crowd, simply that this is a group that's out and about. It's gone from 6.5 to 11.4, almost doubled. And then here, even this, as we get older, 40 to 60-year-olds, we have from 9.5 to 14%. And even the above 60, which when you get above 65, there's a very high vaccination rate in our community. We still have an increase there from 6.6 to 10.4. So it's in every age group. It clearly is out of control. I'm just repeating again what the two other doctors said. This is Idaho state data. First, 98.9% of the positive cases are people who are not vaccinated. 98.6% of the people that are in the hospital do not have full vaccination. 98.7% of the people who have died in Idaho with COVID, no vaccination. I don't know how to put this. This has nothing to do with politics. Vaccine prevents hospitalizations and death, period. Now, just a moment on Delta variant. I think it is worth taking a moment to say here in Idaho, we're just catching up on typing the variants. But I can tell you nationally, 83% of the cases are Delta, and certainly Delta is in our community. We at Primary Health have data that can tell us the viral load on a particular specimen that we've tested. And so obviously, if it's very high, that means, in a sense, that person has a lot of virus and that person could be more contagious. We have specimen after specimen that shows that the viral load is at the highest level, which is my next point. That's why whether you listen on TV to Dr. Fauci or again, you listen to Dr. Nemerson or Dr. Souza, this variant is probably 1,000 times more contagious than what we saw in December. In a sense, the disease we're dealing with today, in some respects, is a different disease. It's scary. It's very aggressive. And so I only have one final point. We have to increase the vaccination rate here in Idaho. If we don't, and we continue to have what starts out as a low level and then slowly rises, this virus, as all viruses, is very, very smart in the sense it will change again and we'll see another variant, and the next variant, maybe even vaccine won't work. So again, very, very concerning in terms of what we're seeing. Let me, I'm hoping you're, yeah, there we go. Stop sharing screen. So there we go. So that's my summary. If you want to ask me questions about our vaccine requirement, I'm glad to answer those questions. But let me make you a point. Let me make a strong point. That really shouldn't be the emphasis of today, and it certainly wasn't the emphasis of Dr. Souza and Dr. Nemerson, which is the three of us. I don't know how to say it. We're very, very concerned. I'm glad to answer any questions, and I also can share slides if people email me or Carissa from our Director of Marketing.
Well, thank you all so much for your feedback and comments there. So we're going to open up to questions now. As a reminder, just raise your virtual hand, wait until I call on you, and then unmute to ask your question, introduce yourself, and to whom the question might be directed to. So I saw a couple of hands pop up. Audrey, it looks like you were first on the list, so why don't you go ahead with your question?
Hello, this is Audrey Dutton from the Idaho Capital Sun. And I think this is directed to Dr. Nemerson, but I'm wondering if you all have thoughts on this regarding what you said, Dr. Nemerson, about the trust issue, and that goes to the media, to us as well. People who are seeking out information about COVID, the Delta variants, vaccination, often are already on board, or they're very much not on board. And it's been a year and a half now. So what are your organizations doing, or what kind of plan is there to reach people who aren't looking for the information, who may not know where to look for it? And what's the plan to better educate people after a year and a half if we're still having these kinds of conversations?
Audrey, I'm pleased to go first. So at St. Alphonsus, we're doing obviously several things. We've got a media campaign out there, which I'm sure you're aware of, with informational public announcements and so forth. But really, I think what we're finding is that the most effective tool we have is our own physicians combined with our mobile clinics. And so our doctors are trying to be as proactive as they can when they have any patient encounter for any reason to promote the vaccine. Within our facilities, we've got the ability to administer vaccine immediately upon demand. So if a patient comes into certain of our clinics where it's available, we'll give them the shot. Similarly, in our hospitals now, we're beginning to offer vaccine to inpatients who may be coming in for something entirely unrelated to COVID disease, like they're having a back surgery. Hey, we'd like you to get the vaccine. Would you consider it? So we're making it very accessible and we're promoting it. And then I mentioned our mobile clinics are out there going to community events where we have our colleagues in front of those mobile clinics promoting the vaccine and making it accessible. And similarly, we're thinking in other innovative ways, how can we be proactive to get our footprint out there so that people know that they can get information from us, and if they, upon hearing the information, understand the reality that's been shared by all three of us right now, that we then have vaccine immediately available to put in their arm.
Thank you. Joe, it looks like you're next, and then Zachary, you're after Joe.
Joe Paris with KTVB. I know we've had claims and questions from members of the community about the vaccine requirement for employment, and there's fears that there could be a significant amount of employees that quit over it, which could lead to more staffing issues. For all three of you, can you comment on if there are fears that the vaccine requirement for employment could lead to staffing shortages, or is it kind of what Dr. Nemerson said, where most employees are on board?
Yeah, I'll take that. I'll take that first. This is David Peterman. We've had a immunization policy requirement for our employees for 10 years. 10 years. That policy is consistent with Equal Employment Opportunity Commission. Is consistent with employment law, and we've not had any problems with that for 10 years, and it includes requiring our employees to be vaccinated for influenza, and we have a process for exemptions, again, that's been existent for 10 years. The media, I guess people that are out there protesting nutty stuff on social media, that may be going on. Here at Primary Health, this is a ho-hum. There's nothing, I have zero concern of not having enough employees because we have a policy that's been in existence for 10 years. I would say quite the opposite. 9 months ago, I had to close 7 clinics. I had 30% of my employees out, either with COVID, contact, or symptoms. I took the Hippocratic Oath, do no harm. And in the current position I'm in, absolutely, it makes sense. It's part of what we do. It's part of our culture that we require our employees to be fully vaccinated to keep the patient safe and to keep ourselves safe. And again, I reiterate, this has been in existence for 10 years. There's no panic. There's no disruption. This is normal business for us. It's very, very unfortunate that, and I understand it, but it's very unfortunate the media has focused on a very vocal few as opposed to, in a sense, the very boring business as usual that of course our employees are being vaccinated. And our experience is exact as Dr. Nemerson. We started out at 80% and it's rapidly going up.
Yeah, I can jump in too. I would share what Dr. Peterman said. The overwhelming majority of our people are fully supportive of this. Again, when we started, we were at 80%. In the conversations we've been having with our people, I'll channel some of what Dr. Nemerson said. We're approaching those, with wanting to listen, wanting them to be heard, wanting them to explain their, legitimate concerns they might have, and then meeting that with factual information. I would say what I've learned is that there actually is a significant group that was sort of waiting on the sidelines. I was a little surprised by that in these conversations, but folks were like, well, I just didn't get around to it. I was going to do it, and now that it's required, I'll get it done. There's a larger group with legitimate questions who I think haven't had the opportunity to get in front of people they trust, the physicians they work with. So much like Dr. Nemerson described, we too are getting our physicians out there in front of our people to answer their questions and engage in a dialogue. And in a dialogue that is significantly more measured than sort of a black and white one, where we're listening and conversing and understanding one another. At the end of the day, I mean, you asked, are we worried about it? Of course I'm worried about losing any of our people. And I'm worried about that potential impact on capacity for care. And I understand that we will probably have some people who decide to leave. But we're going to handle it just the way we've handled it throughout this pandemic. Okay, you just heard from Dr. Peterman what he had to do. He had to close clinics. Early in the pandemic, we had to close an entire facility in Wood River because it wasn't safe for patients and it wasn't safe for our people at that time. So, we'll do whatever it takes, reduce elective work, move staff to more needed areas, but we will not sacrifice safety ever.
And I'll jump in. I really can't add anything to what Dr. Peterman and Dr. Souza have shared. We're taking the same approach. We have the same concerns. We would regret losing even a single employee to refusing to get vaccinated when they're fully capable of doing so and qualified to receive that degree of protection. The one thing that I would say is that, as Dr. Souza said, those employees are very few and far between, and we hope we can get the information to them and they can approach it in an open-minded way and make a good decision for themselves. But what we do also have is we have some handful of employees who have legitimate medical concerns and want to make sure the vaccine's not going to hurt them. And we have also some employees who have faith and are really questioning whether the vaccine is permissible within the context of their faith. So we have medical and religious exemptions to allow for that. And what I have found personally, because I've had many of these individual conversations, is the vaccine is rarely contraindicated. It is almost always able to be given to a employee. If not by one manufacturer, we can use an alternate manufacturer. And it just takes a little bit of time to explain that their particular medical condition is something that is not a reason for not getting the vaccine, and they're going to be safe. And in fact, and this is the most important point I can make, if they get COVID, they're going to be far more harmed by that virus, and that virus is going to make their existing medical condition magnitudes worse than any possibility of harm from this vaccine.
If I could just follow up, again, I think what you're hearing is, so again, what I hear in the media, I guess I'm blaming you, but I don't mean to, or Facebook, is this all or none. If you don't get the vaccine, we're going to fire you. And I think what you just heard from both doctors here, and maybe I didn't say it maybe quite as elegantly, but this is discussion with every employee. Those that are already vaccinated, those that have questions. Again, we've done this for 10 years. We have a whole process for exemptions in which the employee, in a sense, blinded from David Peterman, so there's privacy, where they have an opportunity to express whether it's religious or medical and have a dialogue back and forth. What I'm very proud about at Primary Health is we're very diverse. We, you know, whether it's every religion or every political leaning, they're all part of primary health, and we're proud of that. And so you have to acknowledge those differences and give people an opportunity to express their differences and then sit down and try and make it work. None of these three institutions ever treats an employee the way it sounds like in the media. That's not how we act. Every employee, similar to every patient who has concerns, we give them an opportunity to discuss it. And again, the experience here at Primary Health here is really ho-hum. We're just not having a major problem at all. I'll tell you the biggest concern is we've gotten a I probably shouldn't bring this up. We've gotten notification there's going to be a protest at one of our clinics, and our employees are concerned. They don't want to feel threatened coming to work. They know what's going on with COVID right now, and they know they need to be here to help those patients. I hope we could talk more about coronavirus and less about requirements.
Thank you all. Zachary, I have you up next, and I have Ian after that.
Good afternoon, doctors. This is Zach Brule with KMVT News and Twin. This question is for Dr. Peterman, and I think I'll make you happy. To your talking about positivity rates, you said that there's this hike to 14% positivity rates causing concern. How do those figures compare to our peaks in November, December, January?
Yeah. So again, at that time, I should have anticipated that question, and I'd have that graph right in front of me. I don't have it right in front of me. We are getting close to the highest, but actually, I can't remember the month, but we got above 20% for a couple of weeks, and I don't think it was December. I just can't remember. But yes, we are heading in that direction. We're not at the highest yet. But I think if you're a primary health and we're out here seeing thousands of patients daily, we're beginning to see that, I wouldn't call it a frenzy, but we're getting to see that momentum, that demand. And you start seeing so many positives daily, it's very concerning, very concerning. And thank you for the question.
Thank you.
Thank you. Ian, I have you up next, and Paul, you're after.
Hi, I'm Ian with the Idaho Statesman. This is for anyone who'd like to jump in. I wondered if you could speak to how effective it seems either the Johnson & Johnson, Pfizer, or Moderna vaccines are against this Delta variant based on what you're seeing so far.
I'm going to take a first crack and just say, I'm going to repeat, we're not seeing hospitalized patients who have received the vaccine. And when I say the vaccine, I'm talking about all or any of the vaccines. You know, I have 3 points to make. Get the vaccine, get the vaccine, get the vaccine. I think I said that yesterday. You know, maybe I'll use this opportunity to make one other point, because I've started to hear a little bit of a false narrative, because there are breakthrough cases, right? With all of the vaccines. None of the vaccines were ever billed as being 100% effective in preventing an infection. But there's this concept, right, of the vaccine protecting you from what has been another true north for us in the pandemic, protecting the capacity for care for the communities that we serve. You can almost think about the vaccines a bit like body armor, right? I mean, that allows police officers and soldiers to go out and do their job and take a bullet and live to talk about it. So too, the vaccines, there are breakthrough infections, and they largely come across like a cold. That's the point. They don't lead to hospitalization, and they certainly don't lead to ICU hospitalization.
And Dr. Souza, I'm going to tag on to that to say, for some people, any of those vaccines are 100% protective against even the most extreme variant. For others, they're partially protective, but essentially in no one are they not protective. And so that's the most important point. We talk about these other percentage figures, and I think it just makes people's head explode. It certainly makes mine explode, because it's not about the population when it comes down to the person that has to worry about getting sick from COVID. It's about how much does that vaccine protect me? It protects virtually everyone to some more or less strength. So get protected.
Thank you. Paul, you're next.
Hi, this is Paul from the Idaho Press. I'm not sure who this is best for, but I'm wondering I know you talked about the Delta variant. Is that the main driver of this surge that you talked about, or is there anything else that you think is factoring into that as well?
I'll just say, we believe that Delta is a major driver. I think Dr. Peterman pointed out, we don't have high level of confirmation in terms of the sequencing. If you guys get on the CDC site, where I think Idaho is lumped in with Alaska, Washington, and Oregon, they can show you the breakdown of the variants. Maybe the most important point to make is that the original SARS-CoV-2 is like less than 5% of what we're dealing with in all those states at this point. We're in a post-original SARS-CoV-2 world. We're dealing with variants, Alpha, Delta, Gamma, Epsilon. We don't have any Lambda here yet, but each one of these kind of has its own unique variations. I think what you've heard from all of us is that the most concerning improvement it's made in itself with this latest iteration of Delta is its ability to create way more virions per infected individual, therefore making it way more contagious. So it will find the pockets of where there's not immunity.
Yeah, I think we have to emphasize the surge is driven by the unvaccinated population in the state of Idaho. And so that's the predominant contributor. And then the fact that it's a Delta variant, which is more virulent and more contagious, makes that worse. But we'd be in a surge situation more than likely. If it was a different variant, it just wouldn't be as intense. And the growth rate that we're starting to experience is a manifestation of the Delta variant superimposed on the unvaccinated.
Just to make an analogy that may be helpful, this change in a virus's characteristics and, in a sense, a new virus, the three of us, this is part of, in a sense, normal virology, normal what we deal with. A good example of that, you may recall, well, you know, every year we get influenza, and there are two types, one's a B and one's an A. You may recall when we had, quote, swine flu that particular year, how virulent it was, the large impact it had on the world. And that's because, again, it was a variant in which it came out with that kind of aggressiveness. And so in that regard, the three of us, all physicians, this is not a new concept, the idea that a virus changes and responds. Again, we're all going to say, broken record, there's such a chance to stop this. I like what Jim said. Get vaccinated, get vaccinated, get vaccinated.
Thank you. I see a few hands are up. I'm not sure if you guys have a secondary question. Joe, is your hand up for another question?
Yeah, if we have time, that'd be great.
Go ahead.
Okay, so the message I'm getting from the three of you is, something needs to change now. And of course, we've touched on the importance of the vaccine. Beyond the vaccine, would you suggest or recommend any steps beyond that? I know of note recently, we saw Los Angeles County going back to masks indoor for those vaccinated and unvaccinated. I know the three of you don't make health policy for the state or for health districts, but what would your recommendations be heading into the fall?
That should tell you something, the hesitation there.
No,
I was going to say, I was going to start with what we've done at Primary Health, and be careful when I speak about public policy. Given just what you've said, and that's a great question, here at Primary Health, based on CDC recommendations, we allowed our employees in non-clinical areas, those that were vaccinated, to take their masks off. We changed our policy 48 hours ago. All employees at Primary Health are wearing their masks at all times, and particularly when they're around other individuals. And so that should give you a sense of what we think. I can institute policy at Primary Health. It's a different matter when it comes to Ada County or Canyon County or the state. But I would say this, if someone asked me the question, if I've been vaccinated, should I wear a mask when I go to Albertsons? And my response would be yes. And as I shared with Jim yesterday, I've been married 40 years. And every time I disagree with my wife, of course I'm wrong. And she continued to wear her mask when she went to Albertsons, and she was right. And so we're back wearing our masks when we go inside to crowded areas. And now I'll go ahead and let Jim and Steve speak.
Yeah, over at St. Luke's, we are actively reevaluating the same policy change that Dr. Peterman just spoke about. Our team of clinicians that advises us on our policies has that on their next meeting agenda. You're already starting to see, though, behavior naturally move in that direction. I too continue to wear my mask in public places. And maybe the last thing I'd say, I'm not sure that our municipalities and government entities always necessarily followed us in healthcare, but I do think that we had rich conversations And I think we influenced some of those policy decisions. And I bet you all three of us are interested in that same sort of engagement and conversation with our civic leaders.
Yeah, and I'd add a couple things. We at St. Alphonsus Health System have enforced a mandatory face covering policy throughout the pandemic, and we're continuing to reinforce and now re-message around that. Second thing is that in our predictive modeling for surge, we've actually built in a prediction based on the July 4th social interaction and the expectation that people were with strangers and didn't cover their faces and didn't maintain social distance. And I think we're seeing that. In fact, that's why things doubled 2 weeks later. So we built that in. And candidly, we're now talking about how we build in the prediction for return to school if there is not a face covering requirement in our public schools in the state of Idaho. So we would encourage our leaders to take a really critical look at that in the context, particularly of Delta variant, and the fact that the youngest age group is the one that is the least vaccinated. In fact, if you're under age 12, you can't even be vaccinated yet. And the risk of spread in congregate, meaning close interactions among students. And the last thing I want to throw out there, and I want particularly Dr. Peterman and Dr. Souza to validate this, we are not saying that we don't believe people should go back to school. Far from it. What we are saying is that people should go back to school safely and protect themselves and protect each other.
Just to add on here, boy, Steve said that so well. The American Academy of Pediatrics came out 72 hours ago, Monday, I guess, with a statement that children should be wearing masks in schools, whether they're vaccinated or not. Again, I think the three of us have concerns if Delta is in the community, which we believe it is, children are congregating, what that impact's going to be, particularly if we have adults that are not vaccinated. So we have concerns.
Thank you. Zachary, do you have another question?
I sure do. This is Zach again with KMVT. I have this question for Dr. Souza, but either of the other doctors could touch in as well, but I'll start with you. You had the analogy earlier of the straw on the camel's back sort of thing, turning into the bale of hay. How close are we to that bale of hay, if you will?
Yeah, I had a question like this yesterday, and I'm going to answer it in a similar way. I mean, for those who aren't inside of healthcare systems, you don't maybe intimately understand how it is a going endeavor and always constantly changing, literally hour to hour. And like the pros who are our operational colleagues who staff our units and move the people around, like that's a real skill set. And they do it all the time, and they do it really well. So I'm always challenged when asked that question to peg a moment in time and say, well, at this moment in time, we're at whatever, 95% capacity. And because 4 hours later, it might be at 105. And 4 hours after that, it might be back at 85. It's highly dynamic, but I don't want to totally chicken out on this question. I'll tell you that yesterday in our part of the state, I think of the 99 critical care beds, 90 were occupied. That should make everybody go, wow. Now today, I don't know what's happening at St. Alphonsus. Today on the St. Luke side of town, we got a breather. We were successfully able to move some patients out. The point is, when you get to the top of the tank here, and the margin for error becomes this slim, we will make the decisions that we need to make in terms of doing less elective care and moving patients from those units to support other units that are surging. All of us we developed during the pandemic, contingency plans and surge plans. They're all there and they're ready to be dusted off. And we don't have to do that if we could get everyone to get vaccinated. We're already in a surge, as Dr. Nemerson points out. To some degree, that's going to play out now for the next few weeks, whatever has already happened. But it is not too late to impact what's going to happen 2 to 3 weeks from now by getting a vaccine. Did I answer your question?
Yes, I understand that it's a dynamic and difficult question, but there are definitely some answers in there.
Okay.
Thank you, Doctor.
Thank you.
Okay, Jake, I see you have your hand up as well.
Yes, this is Jake Garcia at KIVI, and I just had a quick question about trends. Are you seeing trends of reinfection or cases of those who are under the age of 12 who cannot be vaccinated?
I'll say I'm not aware of trends in reinfection. And I'm also not aware of a large surge in inpatient pediatric activity at this time.
And I'd say that's our experience at St. Alphonsus as well, but we are seeing reports nationally of people who have been infected a second time with COVID. It appears to be a second strain. So if you were if you got COVID previously with the initial strain and now Delta comes back around, you are potentially vulnerable. And the reason I emphasize that is it's one of the reasons that it's so important to get vaccinated if you've had COVID before. We know that the vaccine augments the protection significantly against COVID, and it reduces the risk of, if you get exposed to a different strain of COVID, that you're going to get infected.
I'll only add one thing, and regarding this sort of a demographic question, we are seeing, and I think we all are, and I think this is being reported nationally, the average age of infection is coming down. Again, probably largely a testament to the efficacy of vaccines, given that the older population has more successfully been vaccinated.
Correct.
Thank you. Ian, I see that your hand is up.
Yeah, thanks. This is Ian with the Statesman. Dr. Nemerson, I believe in particular, earlier you were mentioning that hospitalization numbers for non-COVID are high or relatively high at the moment, and that maybe is part of the reason that it's more concerning if we're starting to see a rise in COVID hospitalizations as well. I wondered if you or anyone else might speak to why you think those numbers are rising or higher at the moment for non-COVID illnesses.
Sure, we had said we would comment on that, and this is a perfect time. It's a combination of multiple things. First of all, it begins with the fact that people are not maintaining social distance and they're taking their masks off. So they're getting other kinds of infections. We've seen an uptick in respiratory syncytial virus in children, that's one. And we've seen other kinds of infections like regular pneumonias, to talk about another kind of infection. So that's one contributing factor. A second is the fact that patients have neglected their health care because of the epidemic. We know this based on a whole variety of metrics that we use, including people just not coming to the doctor. And so as a result of that, they're coming in sicker with more complications from diseases that they already carry, things like heart disease, lung disease, kidney disease, et cetera. And when they come in, they're sicker. So that's a second reason that we're seeing problems. Related to that, by the way, they're staying longer in the hospital as a result. So when you can't get patients through the hospital as quickly, they back up in the hospital, and that increases their census. A third factor is probably the heat and the environment here in Idaho. As a result of that current climate, it's impacting people both in terms of their comorbid diseases and the fact that they exert themselves and get weaker outside, and then other factors as well. But those are some of the principal ones.
Just to add, what our family, and I know the two other physicians, we've discussed this, the mental health issues following coronavirus. As a pediatrician, I've never, and I've practiced many years, I've never encountered among children the enormous number, and at a very young age, severe anxiety and depression. And if you have severe anxiety and depression and you're a 40-year-old with diabetes and hypertension, and maybe you're quarantined in your house and now you turn to the closest drug, which may be alcohol, or you're eating too much, which some of us do, of course, when we're nervous or depressed or what have you, the mental health issues have really, according to our family doctors, really impacted their patients with chronic disease. And again, even me as a pediatrician, you're seeing two doctors here who work in the hospitals that are very measured and very calm, but it doesn't take much to get above what they're keeping under control. And I hope what you take from this, and it can help us articulate to the public how, for us to get through this next winter, we've got to get more people to be vaccinated. And sure, we're asking for your help. Jim may want to add on to what I said here.
I have only one thing to add. I can confirm that we are seeing a definite increase in our discharge diagnoses that include behavioral health diagnoses. They're not the primary diagnosis, but sort of a travel with. And to Dr. Nemerson's point, that's something that exacerbates chronic disease. If you have poorly managed depression or other behavioral health problems, you're less likely to take care of your chronic disease. The other thing I can point out is that at least at a couple of our acute care sites, we have seen a definite uptick in substance use intoxication presentations. And I think that's a nationally known fact that alcohol consumption in the United States and drug use has actually gone up during the pandemic. That too is this undercurrent underneath the chronic disease. If you're intoxicated and you're probably not going to manage your diabetes, your asthma, your heart failure very well.
I want to call out one other thing, if I could, and that is hospital census right now is really a matter of increased admissions to our hospitals because of the things that I mentioned. But one of the major concerns that we all have at this moment is difficulty in discharging patients to post-acute care, including home. And a victim of the pandemic that we've had is that there aren't enough employees to take care of people in specialized nursing facilities. There aren't enough home nurses now, and there aren't enough family members to stay at home and take care of their loved ones in their home. And while that's not a major contributor yet, we're on the cusp of it becoming a major contributor to being able to discharge patients to home safely. And I would actually encourage our members of the media, as they're exploring this issue, to speak to some directors of nursing homes and home nursing agencies around the problems that they're encountering, and also facilitate their ability, just like our ability, to hire people who are committed to the care of their fellow human beings.
Thank you all. I'm not seeing any other questions. So with that, thank you to our panelists for joining us today, and thank you to our media partners. We appreciate it.